Dr. Lamas, thank you so much for joining us. What can you tell us about what's going on the front line?
Well, thank you so much for having me. You know, one thing that I have been thinking and talking a lot about in terms of coronavirus in the ICU is that as the numbers of cases have increased in our country, we've had to make a lot of changes to how we practice medicine. And there are the changes that the public is more aware of, the fact that we need to wear and need access to personal protective equipment, the fact that there are worries about machines like numbers of ventilators, but it's also changed the very dynamic of how we interact with patients and with their family members as we've had to limit visitors in the hospital.
Well, right. I mean, let's face it. I mean, you guys get up every day and you go in there and you're not wondering if you're walking into a hot zone. You know, you're walking into a room where the coronavirus, where COVID 19, the disease is present, and you're having to interact with those patients. What do you say, just as a human being? This has to get on your mind and wonder if you're going to get infected and then take that home to the people you love. What do you say to yourself about that?
Well, it's definitely in your mind. I mean, you'd be being dishonest to say otherwise. But you wear the equipment that you're given. You wear the mask. You wear the eye protection, and the real sort of truth of it is that this results in us being in rooms for sort of shorter amounts of time. I mean, we have made changes to even how the equipment are in the rooms such that we don't have to go into the rooms as much. Nurses have moved IV poles so that instead of next to being next to a patient's bedside, they're actually outside the door. We have extension tubing so that we can have the ventilators outside the door. I mean, all of this causes the patient to be more isolated, but it allows us to not run up against so many limitations of personal protective equipment by entering rooms less frequently. And it allows us to try to keep ourselves safe while taking care of others.
How has this changed your bedside manner?
I think that the necessity of wearing a mask, of wearing gloves, of wearing a gown, of wearing eye protection, I mean, that is quite literally a barrier. And so sadly, I think this has changed our bedside manner and not for the better.
Yeah, when I was practicing, I used to make rounds every day, and so I've been thinking about what you're having to go through now, and it seems like there's this tension between safety and tenderness, caring and comforting, and trying to maintain the balance of protecting yourself and those you love. It's got to change the dynamic, the emotional dynamic between you and your patients.
Entirely. And it's something we think about. I was talking to a nurse that I work with yesterday, and she was relaying an event where she had been present for the death of somebody who was being evaluated for coronavirus. And in this setting, they actually ended up making some exceptions, and one of or two of the family members were able to come in, but were put in gowns and masks, which is clearly not something that is sustainable as these supplies grow short.
Right.
And she was describing how she was trying to talk to this family and explain to them what was going on. And she felt so limited. She felt so limited by the fact that she was wearing all of this equipment, that she didn't want to touch anybody else's hands or bodies, that she knew she should stay 6 feet away. And she said she felt almost like some sort of robot who was just telling them what to do, and that this sort of human aspect that had been such an important component of her nursing had been another casualty of this virus. I as of now, I'm not in New York. I'm in Boston. We don't have that degree of numbers yet, but we see it perhaps coming down the pike. And even in our smaller sort of numbers, we have these conversations. I have conversations with families, and they understand why they can't come. They're graceful about it. But God, they are sad and they are scared, and they too are isolated. I mean, they're in their homes alone and they're scared and they don't have anybody to turn to. And
Sure.
it is just immensely tragic. And you feel, though you feel excited to be part of, fighting this virus and hopefully making people better, you're also aware that there's a huge degree of sort of long-term psychiatric damage that can come from this.